What if I told you that a simple glass of water could be the key to controlling blood sugar and preventing diabetes from advancing silently over the years? Yes, you heard that right. I'm not talking about miracle medications or restrictive diets that are impossible to follow. I'm talking about something so simple, so everyday, that we often don't give it importance. Water. I'm Dr. Theodore Chambers, and I want to tell you something that surprised even my own professional colleagues. We discovered that it's not just the amount of water you drink that matters, but also the timing and the way you do it. It seems like a small detail, but it can make an enormous difference. According to research conducted at recognized medical universities, drinking water at the right times can increase insulin sensitivity by up to 40%, that substance the body produces naturally, and that is essential for controlling blood sugar and avoiding dangerous spikes. And you know what's best? You can achieve this without spending money on expensive medications, without forcing your body with extreme fasting, and without drastically changing your routine. Just by adjusting a habit as simple as when and how you drink water. There's a silent condition that affects millions of older people without them noticing at first. It's called type 2 diabetes. It's the progressive accumulation of sugar in the blood that damages organs and vessels. At the beginning, you hardly notice it. You feel a bit more thirsty, get tired faster, wounds take longer to heal. The data is really concerning. According to recent studies, more than 30% of people over 60 years old already show signs of prediabetes or diabetes, and from 80 years on, the figure rises to 1 in every 2 people. And here comes the most frustrating part. Many people do everything they should do. They eat fewer carbohydrates, take medications, walk every day, control portions. But still they notice that sugar rises, that they feel tired, that levels don't respond the same way. I myself, as a physician specialized in glycemic control, saw this constantly in the office. Disciplined patients who followed their diets to the letter, but who remained uncontrolled without understanding why, until I discovered something that completely changed my way of seeing this problem. It has a lot to do with how and when you drink water. If you want to control sugar, avoid complications, and maintain your vitality for many more years, I invite you to subscribe to the channel right now and activate the bell. For years I felt that there was something that didn't fit right. It was as if a small but essential piece was missing, and finally that piece appeared. It was something so simple, so everyday, that almost no one pays attention to it. The way the body hydrates. Yes, we're talking about water, but not about drinking 8 glasses a day like a meaningless rule. The difference lies in when, how, and what you accompany that water with. Because when done correctly, the body doesn't just absorb, it takes advantage. Drinking water at the right time can activate natural processes that favor insulin sensitivity, the one in charge of lowering sugar, transporting glucose to cells, and keeping the body full of stable energy. Today I want to share something very special with you. A simple but profoundly effective method that has already helped more than 10,000 people regulate sugar, recover energy, and prevent the progression of diabetes. This protocol, which combines a specific form of hydration with small adjustments in the daily routine, has demonstrated surprising results. Let's start with something almost no one explains. Most people drink water incorrectly, even when doing it with the best intention. Today I want to clarify the 3 most common mistakes I see every week in the office. First mistake, waiting to feel thirsty. If you wait to feel thirsty to drink water, you're already late. Thirst is not a preventive signal. It's a warning from the body that says, I'm already dehydrated. When you notice a dry mouth, the organism has already lost about 2% of the water it needs. And although that number seems small, it can raise blood sugar by up to 50. Second mistake, Drinking large amounts at once. Many people believe that drinking a liter of water in one gulp regulates sugar better, and that's not the case. The body can only absorb about 200 to 250 millibars every 15 minutes. The rest is simply eliminated. Effective hydration doesn't depend on the total amount you drink, but on how you distribute it throughout the day. Third mistake, drinking very cold water. Very cold water causes a contraction of blood vessels, which reduces blood flow to tissues. Therefore, the ideal is to drink water at room temperature or slightly warm, between 22 and 24 degrees. Now that you know how not to hydrate, let's get to the important part, how to do it right. I'm going to teach you the method I created after years of observing hundreds of patients. I call it the H3+1 Method. It's 4 small steps that can transform your metabolic stability in a few weeks. Step 1. The morning glass. Drink a glass of about 350 ml of warm water right when you wake up, before having coffee, and add a pinch of unrefined sea salt. That small amount of minerals activates the hormonal and metabolic system naturally, helping the body to regulate sugar correctly. If you want to do even better, add a few drops of natural lemon. Step 2. The glass before eating. About 15 minutes before each meal, drink a small glass of water, about 150 ml. This small amount prepares the stomach to receive food, favors the production of enzymes, and delays the absorption of carbohydrates, avoiding glucose spikes after eating. Clinical studies showed that older people who incorporate this habit reduce their sugar spikes by up to. Step 3. Water during exercise. If you do any type of exercise, even if it's just walking, this step is fundamental. The ideal is to drink about 100 to 120 ml every 15 minutes of activity. This rhythm keeps the volume of liquid in the blood constant, which prevents glycemic fluctuations. And here comes a trick I especially recommend. Add a pinch of cinnamon, about 5 grams, for every 250 ml of water you drink during exercise. Cinnamon helps cells respond better to insulin. Step 4. The +1, the night glass. Take about 250 ml of warm water a few minutes before going to bed. But here we add a special ingredient, magnesium, 200 mg of citrate or bisglycinate. Magnesium is one of the most important minerals for improving insulin sensitivity, avoiding nighttime spikes, and enhancing deep sleep. This glass of water with magnesium is what I call the regulation glass. How do you know if H3+1 hydration is working? I propose you follow this protocol for 7 days. These are the clear signs that the method is working. Less thirst when waking up, more energy 60 to 90 minutes after breakfast, less swelling in the ankles, light yellow urine, less drowsiness after eating. Now we come to a question I'm often asked. Doctor, how much water do I have to drink per day exactly? That rule of 8 glasses doesn't work for everyone. Your body doesn't need the same as your neighbor's. That's why I prefer a personalized formula, your weight in kilograms multiplied by 30 ml. For example, if you weigh 70 kilos, multiply 70 by 30. The result is 2,100 ml of water per day. That's your base amount. And if you exercise for each hour of moderate physical activity, add half a liter of extra water. How do you know if you're drinking enough? The color of urine. If it's very light yellow, perfect. If it's transparent, you're drinking too fast. If it's strong yellow, you're dehydrated. A simple trick. Use a reusable bottle of about 750 ml. Fill it 3 times a day. The first in the morning, the second before or after eating, the third in the afternoon. Now comes the time to talk about the silent enemies of glucose-regulating water. Those small habits that seem harmless but can actually ruin all the effort. 1. Coffee on an empty stomach. Coffee, mainly when taken on an empty stomach, acts as a stimulant that raises cortisol and glucagon, causing the liver to release more glucose. Each cup can increase basal sugar by 10 to 20 mg per deciliter. Therefore, before morning coffee, first drink a glass of warm water with sea salt. 2. Sodas and carbonated drinks. These drinks are bombs of refined sugar and phosphorus. Sugar causes immediate spikes. Phosphate competes with magnesium. If you feel like something with flavor, opt for natural sparkling water with a few drops of fresh lemon. 3. Distilled or too pure water. Distilled water or some heavily filtered waters lack essential minerals. When you drink water without minerals, the body tries to compensate by releasing the few minerals it has. That's why we need living water with minerals. If tap water is drinkable, filter it and add a pinch of sea salt. During the first month of the H3+1 protocol, avoid these 3 enemies as much as possible. Give your body a real opportunity to recalibrate glycemic balance. Look, after more than 20 years, seeing patients day after day, I can say something from the heart. Type 2 diabetes is not an inevitable sentence of age. It's a sign that the body has been asking for help for years, in the simplest way possible. Today I gave you the most powerful, cheap, and natural tool that exists. A glass of water, drunk at the right time, with the right minerals, and avoiding the most common mistakes. If you apply at least 70% of what I told you today, in less than a month you'll notice that your energy is more constant, your sugar numbers are more stable, you sleep better, mainly you recover the feeling of control over your own health. I don't ask you to believe me. I ask you to try it yourself for just 14 days. And when you notice the difference, come back here and leave a comment. Right now, do 3 things. Subscribe to the channel and activate the bell. Leave a heart down here to commit to yourself. And share this video with that person you want to be healthy for many more years. Thank you very much for making it to the end. I feel very honored to accompany you on this path. See you in the next video. A strong hug.